The journey from Warri to Ogara in Delta State is about 13 minutes. The governor arrives at the Delta State University Teaching Hospital, Ogara, and straight into the neonatal intensive care unit, where biphasic positive airway pressure machines and the retina camera machine are positioned for commissioning. The consultant ophthalmologist on duty explains how the RETCAM is used to diagnose neonatal eye abnormalities.
So what we do is we seal a coupling fluid on the cornea of the neonate's eye, and then with the aid of the camera we focus on the fundus from various quadrants of the eye, and then the images are captured of the fundus of the eye. So once the images are captured, the grading of the retinopathy is viewed, and then we are able to send these images through a server to other hospitals across the world for interpretation and also for necessary intervention.
So how many of these do you have in Nigeria?
Just this one.
So that means I want to formally commission this equipment that we use for mapping.
Amen.
A consultant neonatologist with DELSUD talks about the CPAP machines.
It's a form of biphasic positive airway pressure ventilation, and what it does is for babies who have mild to moderate respiratory disease, it's a form of ventilatory support that supports their own breathing. So with babies who put on this level of ventilation, they're able to continue to do their own breathing. With nasal prongs through their nose, it blows air directly into their lungs. And the difference about this machine from other machines that some other units would have across the country is that this delivers 2 levels of pressure. So it delivers a top level pressure and a lower level pressure. So this 2 levels of pressure blows the pressure down, gives them 2 functional residual capacity. So their lungs never collapse completely. It stays open, takes the work of breathing off these babies and supports them through their mild disease. We have 3 of the CPAP machines, and then we have 8 ventilators, and of all those 8 ventilators we have, they've also got a CPAP module on them, so we can actually deliver CPAP on those 8 ventilators as well, because we anticipate that when the neonatal network, which has been launched today by His Excellency, takes off, that we'll be getting a lot of babies from all over the state, and with the level of equipment we have, we should be able to cope with that influx.
We've done this because we've noticed that the survival of our newborn, especially when they are preterm, that is when they are born before the time they're supposed to be born, they have a lot of challenges. Challenges of breathing, challenges of in their eyes, so many challenges. And for them to survive, sometimes you require some special equipment. Before now, because the equipment were not available anywhere in Nigeria, these children die. But with this equipment now, we've been able to retrieve a lot of the children and to prevent deaths at that age.
From the Central Hospital in Warri, where a new maternal and child care center has been established, to the Delta State University Teaching Hospital. It's been a long day. Thank you so much for being with us on Health News. From Ogara here in Delta State, I am Yomi Otaigbe, thanking you for watching.